Hello and welcome. Today we will be discussing about Oxyuris equi. Oxyuris equi belongs to the genus Oxyuris and species equi. So as the name suggests, it is a parasite which is found in horses and it is also known as pinworm of horses and false whipworm. Coming to the morphology of the worm, adult female are very long and they may reach about 10 cm in length. However, adult male are much smaller and they have a size less than 1 cm in length. The common anatomy of the worm tells us that this worm has very small inconspicuous lips. Inconspicuous lips meaning they are not very differentiating or visible. Another special feature of this worm is it has a special hourglass shaped oesophagus. Male worm, the tail of the male worm looks truncated or cut off and it has a single pin-shaped spicule which is used during mating. Female worm is much larger than the male worm and it has a long tapering whip-like tail. The eggs of this worm are elongated, slightly flattened on one side, and these eggs have sticky mucoid plug at one pole which helps them to stick to surfaces. Coming to the pathogenesis of this worm, adult worms of Oxyuris equi, adult male and female, live in caecum and colon of horses. After fertilization between male and female, the gravid, that is pregnant female worm, migrates towards the rectum, and once it is in the rectum, it will crawl out through the anal opening in the perineal region. Here she lays eggs in cluster in this region, and these eggs will give a yellowish white sticky streak-like appearance because these eggs are surrounded by a gelatinous material. Now the development of these eggs is quite rapid. These eggs might fall to the ground where they become infective within 3 to 5 days, or sometimes they may even reach the infective stage while still present on the perineal region. These eggs can survive for weeks in moist environment like the bedding materials. However, the dry and desiccating environment like sunlight is very harmful for these eggs. Now, the transmission of infection occurs when the horses ingest infective eggs from the bedding material mixing with the feed. These infective eggs contain L2 larvae. Once the horse ingests these eggs, the L2 larvae hatch in the intestine and the larva comes out. L2 larva now molts to become L3 larva. Molting is nothing but it is the development of one stage of larva into another. Now these L3 larvae, which are present in the lumen of the caecum, they migrate to the cecal mucosa. They come inside the cecal mucosa. Now within 8 to 10 days of this transmission from the lumen to the mucosa, these L3 larvae develop into L4 larvae in this region. Later, again these L4 larvae will migrate in the lumen and where they will finally mature to adult worms. So what is happening? L3 larvae are migrating inside the cecal mucosa. They are developing into L4 and they are coming out again in the lumen and converting or developing into adult worms. Now this period from the infection to the development of adult worms is known as pre-patent period, and the time of this period is about 4 to 5 months. Coming to the symptoms appear due to different stages of this worm. As we know, L4 larvae feed on the mucosa of the caecum. Due to this feeding, there occurs a lot of blood loss which causes irritation to the intestinal lining. Next, the adult worms mainly feed on the intestinal contents which are the digested nutrients. Due to this, the availability of essential nutrients to the horses reduces and the horse will appear weak and debilitated. Next, as we know that gravid or pregnant female worms come out to lay eggs in the perineal region which causes severe itching in the anal region, which is also known as anal pruritus, and this anal pruritus is the main clinical sign of oxyurosis. Such horses will appear restless, they will have an improper feeding and their coat will appear very dull. Next, as we know that there occurs severe itching in this region due to the infection. Now horses, to comfort themselves, they will rub themselves against hard objects like walls and fences. In doing so, the hairs at the base of the tail of the horses will break off and it will give horse an ungroomed or rat-tailed appearance. Coming to the diagnosis section, whenever veterinarians receive such cases, they usually examine the perineal region around the anus after taking proper history. Why do they examine this region? To look for sticky eggs or yellowish streak eggs. Now this condition has to be differentiated from mange because mange also causes itching in that region. However, both of these conditions are clearly distinguishable in microscopic examination, and further, mange causes generalized itching while oxyuris causes localized itching in perineal area. Coming to the treatment, several anthelmintic drugs are used for treatment. First is mebendazole, which is given orally at a dose rate of 5 to 10 mg per kg body weight. Second is piperazine compounds, which are given orally at a dose rate of about 400 mg per kg body weight. Third are thiobendazole compounds given at a dose rate of 100 mg per kg body weight. Coming to the most important section, that is control and prevention. So for the control, good stable hygiene is very important. Now how can that be achieved? By removing or changing the bedding material regularly, because these bedding material contain eggs that contain infective larvae. Next is cleaning the perineal region of the horses regularly, because in this perineal region the eggs are sticked around. Third is maintaining proper cleanliness in the stable and maintaining a distance of the infected and healthy horses to prevent the spread of infection. Thank you for a patient listening. See you in the next lecture.